Hi, I'm Wendy Warner. I'm a functional medicine gynecologist. I did the usual medical training, spent 14, 15 years in a conventional OB practice. And during that time, I was actually teaching myself herbal medicine because I had some conditions that I didn't want to use the treatment that I was trained to use. But I kept my mouth shut because this was like the 90s and docs didn't do this stuff. And so I didn't tell patients about it. Then in 2004, I started an integrative medicine practice. I always say it was sort of like having a multi-specialty group because it was me and an acupuncturist, a massage therapist, a couple of energy workers, a coach, a dietitian, a shaman. It was awesome. We kept that going for about 18 years. COVID changed everything. So now I am a solo practitioner. Well, I mean, I do have a coach I work with, but I have a fully telemedicine practice. So along the way, after I got my functional medicine training and had done the book on my herbal training, I started teaching for the Institute for Functional Medicine, primarily in their hormone module. And I also teach for David Winston, Center for Herbal Studies. I do primarily the women's health module for him, although I do a couple of grad classes here and there. Andrew Appello, who also teaches for David, he and I put together a basic anatomy and physiology course that is available online, and it's aimed at herbalists who need that as a requirement for their herbal training. It would be good for any other kind of healthcare practitioner too. The first time I ever came to Medicines from the Earth was, I don't remember the exact year, but it was somewhere in the early 2000s. And I felt kind of out of my element because I was kind of new to herbal medicine at that point. And almost everybody I met was a professional herbalist. I mean, I did think I met one other medical doctor and a couple of nurses and an acupuncturist, but most everybody back then were professional herbalists. And it was such an amazing environment to be in. And it is so awesome to actually be able to be here this year as one of the speakers. I've had the opportunity to do an intensive workshop on an approach to menopause and talking about the new research on menopause as a neurologic and immunologic condition, as well as a hormone imbalance. I'm also doing a workshop on an approach to fertility, because in the conventional medical model, so many people get told, oh, we don't know what's wrong. And actually, from a functional medicine and a basic medicine standpoint, we can actually help most of these people. I'm also really thrilled to be on a panel with two other brilliant practitioners to talk about how we keep our patients motivated when they've got like diabetes and pre-diabetes. How do you keep them motivated to do the lifestyle changes? And so that's going to be a great fun panel that we're doing as well. And it's just awesome to be here.